from Mexico to Brazil, Professor Sônia Groisman, who's been undertaking a number of studies. Sônia, we can hand over to you.
Good morning, everybody. Thank you, Professor Raman, who invited me to speak on this webinar. And when I was preparing, I was thinking, why should we tell people that brushing, toothbrushing at school should be something relevant? So I came to United Nations Sustainability Agenda, and we are the number 3 because we are health. And through toothbrushing, we can promote health. So that's one big message, that we can achieve health through oral health. And if you see the picture above the agenda, is that why health is a problem that causes most disability. So 10 years ago, health was the 9 problem that cause more disability. 10 years later, it becomes, it increases much more disabilities caused only by oral health. And if you join oral health with other disease, it causes more disabilities. So disabilities would be days that are not work planning, work in plenitude, or days that people lost doing tooth pain. Next, please. So in the left map, we could see why that school brushing is so important. It says the caries deciduous T, how does it affect by this daily, that's a measure that's day adjusted by incapability on years or loss due health problem. So in Brazil, we have a rate of 0.44 or 2.42, that's the highest, and it's a very big score if you consider that 5 is the maximum of lost days due to caries in deciduous tooth in the world. In Brazil, we have a very high score, and dental caries is the consequence also of death, loss, and years lost. And if the children have dental pain, he cannot pay attention and he cannot graduate well and he cannot have a good job, and then it's a cycle of poverty. So one big challenge to change this, it's inside public health brushing programs. And if you see, we still have a lot of caries in Brazil, although the DMFT has decreased very much. The whole DMFT in Brazil is 2.07, but in some areas of Brazil, like in the north and in the south, it's still a high DMFT, and all of it, the majority is due by caries. Could you pass next, please? So that's why we have a law, and we have a program that's an official program from Strategy of Family. And this Strategy of Family has indicators how much the children should brush the teeth, and it's the government pactuated these indicators with the state and the municipality. And we can see by this slide from 2010 to 2015, the historical index and how much they had increased and achieved. And then you see the last graphic, the average, it shows that in each state of the country, the indicators are not stability. They have been going and down all the time. And if you see the last one, just in Rio de Janeiro, we had pactuating the state a goal for 2.5 school children brushing every day, but we achieved only 0.13. Next, please. So how to work regarding this United States agenda, sustainability for 2030, to reduce disparity in oral health. So in that case, toothbrushing is a part of school-based curriculum. It could promote health through oral health, because we always give, as Professor Jaime said, oral education. Oral health is an integral part of overall health and important to prevent, treat, and maintain. we should train dental students and dentists to act in a more humanized way according to the school children group needs. In that case, we don't use varnish because we still need to make automatic restoration. It's important to have health education as completed tools and supervised toothbrushing to improve social responsibility, not only by the graduate students, the school children, and the dentists. So to create, in that program that we used to have, we were used to not to use the teacher, because in Brazil the teachers receive a very low salary and they are already oversaturated with programs. So we create like a school groups of monitors. Those that are bigger, more age, they become responsible for the youngest. So in that case, we also promote them by diplomas and certificates and medals and everything. So that's a way to develop leadership in school children, in dental students and dentists, and to promote universal interchange experience also, because we have students coming from ACTA and now from Portugal to join the program. Next, please. We have each year a work team of 5 post-graduation students, 7 graduation dental students, and 3 students from ACTA. And we had been in many different schools and always integrating oral health in health. And we have this in the left, the big mouse, and it's a big mouse where the students and the teachers go inside. One side is dental caries, the other side is periodontal disease. And we have in this integrated students from the hospital of Federal University of Diabetes. We have from also cardiologists, and to all that want to integrate are welcome, so we can show the relevance of oral health in general health. Next, please. And they are using, oh, sorry, just come back, please, one. We are using the booklet of oral health, maternal and child orientation also. We have many kinds of orientation, of education. We also have, but we have to be adjusted to each place we go. Next, please. Next, please. We have some activities that you can see the mouse I told you, the children inside with the teachers, and we have health education. And we also do this, we brush themselves, we show the parents how to be in position, and how we also use the methodology to do, and then the children do themselves. And when they go to place where they don't have any possibilities to go to the bathroom, we have our this, if you can see in this picture on the right, on the up, we have this portable that are for brushing. And we also have the more adults one, the teenagers that are going to be responsible for the rest of the year. Next, please. We also have been doing this with pregnant women and using the oral health booklets and in unprivileged areas. And the first graphic is for gingival index bleeding, and the second graphic is for visible plaque. And we have been showing that also doing oral health education and motivation together, not only teaching, but having a strategy of working together, we can decrease gingival index and visible plaque. Next, please. We can also we have been doing this a couple of years, 3 years, and this graphic shows how we have been decreasing the number of caries of school children when we act together with doctors or physicians, pediatricians. So in order to make it better, we make a common chart of dentists and pediatricians. So if the patients go to pediatricians and don't have sign that he has been going to the dentist and he's not in a pain or something urgent, he has to go to the dentist before and come back to the dentist. In that way, we decrease 9% of dental caries, and it's in a very unprivileged area nearby the dental school. Next, please. And conclusion challenges in Brazil. Our team work only once a week. So we have 30 weeks a year. That's the school calendar of the dental school. We impact 2,400 school children per year when we do our normal program. When we have a social action that we include other areas and other programs together, then we can impact much more. It's a higher number, but it's only one day. So we can impact 1,300 school children only one day. And this used to repeat it each 3 months, but in each place, not in the same place. You have to remember that Brazil, it's a continental country, it's bigger than Europe, and Rio de Janeiro itself is also very big. So although there are many isolated successful programs in caries concerning school children toothbrushing, in Brazil, especially in the state of Rio de Janeiro, we are far away from the goals that the own government established. Due to the lack of government resource, it's necessary to implement private partnerships in order to improve toothbrushing in dental schools curriculum and benefits a bigger number in school children, like Professor Jaime said in Mexico. Next, please. As we had been working that way not only in dentistry, but more interdisciplinary way, we had been able to launch the booklets of Global Child Dental Fund and Brazilian Society of Pediatrics. And in the last Congress in 2017, we only launched. And last week, we are in Porto Alegre because this Congress is each 2 years, and there were 9,000 pediatricians. So we had a symposium of oral health, and it was really amazing how people were interested in getting engaged in it and how much they need to know. So we divided in a symposium of oral health in the Pediatrician Society, and we make a workshop of brushing and toothbrushing and how to indicate each toothpaste also. And now we have in the future, we launch now the oral health booklet. We will do it in Portugal next year. It's already ready because it's Colgate and Brazilian and Portugal make a combination and they are working together and it's already ready. So I think we should work and improve health, oral health, through general health. And then we get more and more visibility. In Brazil, it doesn't matter if you have a law or not. We have a law that the water should be fluoride, but not necessary it happens. So it's really necessary to be working, checking, and showing that we could progress. And I think we also now had the work with teenagers pregnant with diabetes, because we know that periodontal disease can lead to the delivery of preterm, and we have a great number of teenagers pregnant, and they can develop unclinical diabetes. So we are working now with this, also with our booklet as a base for information, and we have the toothbrushing supervised and to increase the motivation to do it. But we are still need a lot of work and also need help. And the most important thing, it's necessary to make agreements with private organization in order to do that. Thank you very much. And my if you could come back to the last slide, no, the last, my email, if anyone would like to write me, is sonia@dentistas.com.br. Oh, I'm not seeing. Oh, it was in blue. Okay. I am.
Sônia, thank you so much. Thank you for that. It's very impressive to learn what's happening in Brazil. I suppose today's key issue is that so often toothbrushing is parallel and it's just parachuted into schools and then it leaves. And what Jaime showed us in Mexico, how important it is to make it a law, a mandatory. Toothbrushing must happen, and therefore receiving funds from more traditional sources like education, and then building it into the curriculum. I was very interested in your work, how incorporating it into the life of a school, you use other pupils, you use leadership. So you noticed that you had older children who became all health leaders. Do you want to just share a little bit about how that process happened of getting other pupils to become role models and also educators with regard to all health?
Thank you, Ramon, for the question. It's very impressed because when we go to a school, we had that experience in a school in the municipality of Resende, and Resende has the highest municipality school in Latin America. It's a huge dental school, huge school. And when you say you have only a small amount of toothbrush and toothpaste, you have to decide to whom to give. It's a challenge. And then the others are also interested in see what's happening, why they cannot be part of. So those that come interested, when they are part of, they become very, very proud of being that. So we make some bottoms, and then we give them like a leader toothbrushing, and of course we give them we also make a kind of it's not a t-shirt, but it's something to put plus the t-shirt. And once a week they are going to the schools and say, who haven't brushing, we are going to have one brushing day. This was coming in this international program that we did together in ACTA. And Resende, although it's the biggest school children in Brazil, in Latin America, they don't have this program of school brushing every day. The strategy of family, they are very organized, the most organized of the state of the Rio. But even though they cannot get toothbrushing for everybody. So this is make teenagers feel very important because they are responsible and they get more than the teachers, because the teachers receive the salary doesn't change, but they receive a certificate saying they had been in the program and they had been leadership. So this is very proud of them.
Good. Thank you so much. We'll be able to come back. I think the key message here, Sônia, for us is that trying to make toothbrushing part of the life of the school and the community. And you showed us something very unusual about incorporating older children to become part of that. So thank you for that.